I would now like to turn the webinar over to our moderator, Brian Lindberg. Please go ahead, Brian.
Thank you. Good afternoon and welcome to our webinar today on the White House Conference on Aging. My name is Brian Lindberg and I serve as the Public Policy Advisor to GSA and the Change Agents Institute. Let me start with a housekeeping point here first. We'll be live tweeting today from Change Agents 365 account, which is hashtag WHCOA now what. So I have been serving as a DC public policy consultant since 1993, and before that spent 10 years on the House and Senate Aging Committees. And it's a pleasure to be here today to serve as moderator for the webinar and introduce our very distinguished speakers. I'm pleased to say that we have a number of groups involved in the webinar today. We have the Change Agents, the Hartford Foundation Change Agents. We have other GSA members, and we also have invited members of the National Association of Nutrition and Aging Services Programs, and they're all on the line today. So let me start. I'm going to introduce all three of our speakers all at once, and then we'll move on to the first speaker. But let me start with Bob Blancato, who is a well-respected aging and health policy consultant here in D.C. He runs his own firm, Matz Blancato Associates. Let me just highlight a few things from Bob's very impressive resume. You've got a short bio of his. But let me say that I've known Bob since our aging committee days when we might say Congress actually got things done, and he has a very impressive record of cutting-edge aging policy accomplishments in many areas. He served he serves now as the executive director of NANEST, and also the national coordinator for the Elder Justice Coalition. And finally, Bob served as the executive director of the 1995 White House Conference on Aging and was appointed by President Bill Clinton. And not to throw too much personal perspective in, but that I believe is one of the most successful of all the White House Conference on Aging over the years. Next we have Carol Zernia. She chairs the National Council on Aging, one of the most prominent Washington, D.C. aging advocacy groups. Carol holds a master's degree in social gerontology and has been involved in the field for many years. Carol also worked on a number of aging-related organizations, the American Association of Homes and Services for the Aging, which many of you know now as Leading Age. She is now the executive director of WellMed Charitable Foundation and serves as the vice president of community relations for WellMed Medical Management, and we're really pleased to have her with us today as well. And I forgot to note that all of us attended the White House Conference on Aging this year, so we not only have, if you will, academic perspectives, but we were there enjoying the festivities and the announcements as well. And our last speaker, who in some ways will serve as both a speaker for us and a respondent to what she hears from Bob and Carol, is Dr. Terry Fulmer, who is the president of the John A. Hartford Foundation. She has a very impressive resume and academic background, which you all have, but just let me say a couple things about Dr. Fulmer. First, those of us in the aging and health policy and advocacy fields, particularly those of us in D.C., are extremely excited to have Dr. Fulmer become the president of the John A. Hartford Foundation. We have known of her work for many years, and the second point I'd make is that, for example, Bob and I have worked in the area of elder justice, and Dr. Fulmer is nationally and internationally recognized as a leading expert with her work in geriatrics and the topic of elder abuse and neglect. So, and of course, you'll hear today that was one of the highlighted areas of the White House Conference on Aging. So without further ado, let me turn...
Repeat the hashtag.
Oh, I'm supposed to repeat the hashtag. Okay. I'll have to look it up. Here it is. The hashtag that is under Change Agents 365 account is hashtag WHCOA Now What? And let me turn it now over to Bob Blancato, who is going to give us a bit of a historical perspective on the White House Conference on Aging.
Thank you very much, Brian, and good afternoon to everyone. And it's a pleasure to be part of this webinar, and I'm humbled to be on the panel with my friend Carol Zernial and my friend Terry Fulmer, who are distinguished individuals in their own right, and each of whom I've known for quite a while. So let's talk about the White House Conference on Aging history. We had the 6th White House Conference on Aging that was held on July 13th. As Brian mentioned, it was the second of the 21st century. We've had equal number of conferences held with Democratic presidents in charge and Republican presidents in charge. Every White House conference is intended to help make recommendations for national aging policy for the next 10 years. It's always been the mission and purpose, and each has been distinct by when and how they were conducted. My own personal history with the White House Conference on Aging, I just attended my 4th out of the 6 White House conferences. In 1981, when I was just merely 5 years old, I attended as a congressional resource person working for the House Aging Committee. And as Brian mentioned, I had the pleasure of being executive director back in 1995. And I would make a small aside, I was helped tremendously by Carol Zernial, who was the director of volunteers, actually, at the 1995 White House Conference on Aging. A little-known fact, but one that's greatly appreciated. In 2005, I served on the policy committee appointed by then Democratic leader Nancy Pelosi. And then, of course, in 2015, I was pleased to be a White House invitee to this conference. So going back to history, first in 1961, the White House Conference helped lay the groundwork for what we call the Great Society programs of Medicare and Medicaid, and especially the Older Americans Act. The 1971 White House Conference was the largest. It helped pave the way for the introduction of cost of living adjustments under Social Security, which occurred in 1972. Helped form the basis of the Supplemental Security Income Program, which was also established back in 1972. It set the tone for the creation of the National Institute on Aging, which has been hugely important to aging research in this country. And following up on the 61 White House Conference, the specific Older Americans Act nutrition program was a big outgrowth of the 1971 White House Conference, and in fact was the key element of President Nixon's speech at that conference when he gave an initial funding level for the nutrition program. The 1981 White House Conference was a little more volatile. We had 2 legends in American politics at the time, President Reagan and Claude Pepper, who at that time was the chairman of the House Committee on Aging. They had different approaches to how a White House conference should be conducted, and Claude Pepper served as a counter voice to some of the activities of President Reagan. But in the end, the main focus of that conference was to address Social Security, which at that point was approaching a legitimate crisis. And 2 years later, major reforms were made to the program, a number of which came out of the 81 White House Conference. And then we come to 1991, which would have been the 4th in the normal sequence of things, but that one was not conducted for reasons that only are known by the first Bush administration, but it broke the cycle of the conferences. So we move now to the 1995 White House Conference, and that was the last one of the 20th century. It occurred in very interesting political times. In November of 1994, for the first time in 40 years, the Republicans took over both the House and the Senate, and did so on a campaign called the Contract with America. And many of the issues that they raised in that contract dealt with aging programs, Social Security and Medicare, And the delegates came to Washington somewhat agitated about what was in that contract, and they pushed back quite a bit. But in between that, resolutions were adopted by the delegates, and one of the main outgrowths of the White House Conference in '95 was the establishment of the National Family Caregiver Support Program under the Older Americans Act, which became law in 2000. And it was the conference that introduced the issue of grandparents raising grandchildren for the first time, something which has become quite significant an issue in the ensuing years. And then we get to 2005, which was the first White House conference of the 21st century, the first with a focus on boomers, who at that point were beginning to approach becoming aging. And the major delegate focus at this conference and the top resolution that was adopted was to reauthorize the Older Americans Act, which had been stalled in the Congress for a number of years. The White House Conference of 2005 was held 2 years after the historic creation of the first prescription drug benefit under Medicare. The 2005 conference had long-term care as one of its major issues, and President Bush did not attend the 2005 White House Conference on Aging, making him the first president not to participate in a White House Conference on Aging. So then we go to 2015, the current one that we have all enjoyed, and it was announced in late July 2014. It was the first pure White House Conference on Aging in history. What I mean by that is that this was not a White House Conference that was authorized by statute. It was not a congressional and White House event. There were no appropriated funds from the Congress for this White House Conference. So the White House was in charge of putting the conference together on its own, and the woman they chose to be the executive director, Nora Super, did a very excellent job in conducting the White House Conference. Their focus was on alternative ways to do the conference. They held 5 regional forums. There were hundreds of watch parties that were held the day of the White House Conference, and many of people on the phone may have been involved in those. You know, they did engage people just in different ways than perhaps we were used to in the past. And in my judgment, they conducted this conference as well as possible with the constraints that they had. But keeping with that, in the conference, they chose 4 priority topics, which I think were highly relevant for a White House Conference on Aging in 2015. The 4 topics being retirement security, healthy aging, long-term services and supports, and elder justice. And when we got to 2015 White House Conference on July 3rd, President Obama made a very impressive speech at the conference. His participation and his comments were especially relevant, and we were particularly glad to see him call for the reauthorization of the Older Americans Act. At the White House Conference, they announced an impressive array of public-private partnerships which could pave new pathways for improving aging policy across the board. As Brian mentioned, we were very pleased with the special focus on elder justice in this conference, and I would reiterate the fact that we are joined today by one of the pioneers in the world of elder abuse, and that's Dr. Fulmer. And in the White House Conference, some of the things that were talked about were expanding the capacity to train prosecutors on elder abuse prosecutions, and also a new focus on elder abuse crime victims with new funding from the Victims of Crime Act. So in the end, a White House Conference on Aging is always measured by what follows. You know, White House conferences from the beginning through the end have to be reasonable in their expectations. They shouldn't be too high or too low. They must engage stakeholders. And, you know, it's always about advocacy opportunities in a White House Conference on Aging. Proactive to advance new ideas, and sometimes defensive advocacy to prevent bad ideas. But what the 2015 White House Conference on Aging did, in my judgment, was it set important frameworks to focus national attention on aging for the years 2015 through 2025. There will be challenges and there'll be opportunities, and both were discussed. Issues like promoting economic security and addressing the growing senior poverty issue in this country. Promoting health security with issues about access and choices and prevention, and helping to reduce disparities with long-term services and supports being a key to health security in the future. to recognize and respect diversity, with cultural competency not being an afterthought, focusing on aging in place and age-friendly communities that are intergenerational, approaching services in a holistic way in the future, while maintaining a commitment to the vulnerable of all ages, and to promote elder justice by preventing elder abuse. So in my judgment, the 2015 conference did help advance all of these issues and provided an opportunity to present and advance good ideas. The White House Conference of 2015 provided advocates with an opportunity to see more clearly this administration's interest in aging, and of course, we all look forward to what follows. Thank you very much.
Thank you, Bob. I appreciate that. Next we're going to have Carol Zernial. Carol is going to give us a flavor for some of the things that actually came out of this last White House Conference on Aging. Carol?
Thank you very much, Brian. And let me add my thanks to GSA, to the John A. Hartford Foundation, and to all my panelists. I'm very pleased to be here today. And we're going to talk a little bit about the President's executive actions and what came out of the White House Conference, as well as maybe look at some of the things that weren't included in the conference just briefly. So the first slide is an overview of the President's executive actions, and this is a list. I'm not going to read all of it, but if you go to the website whitehouseconferenceonaging.gov and pull up the key deliverables from the conference, you can get details on all of these executive actions, as well as read about a lot of the public-private partnerships that Bob alluded to, where the companies and organizations stepped up ahead of time and worked with the administration to advance and partner on some of these ideas. So it's certainly worth taking a look at the key deliverables from the conference on the White House Conference on Aging website. But I'd like to pull out a couple of these and just talk a little bit more about them. On the next slide, retirement security. Bob mentioned it as one of the key issues. It is probably the scary black hole of all of aging. We know that baby boomers haven't been saving at the same rate as the prior generation. We know that the generation coming up didn't work for one company their entire lives with a nice secure pension. And so, we tend to spend our savings, our retirement savings, as soon as there's a crisis. So there are a lot of questions out there, and several of these executive actions were really intended to combat what is our natural tendency in the United States to spend our money or to go into debt. So the first was facilitate state efforts to provide workplace-based retirement savings opportunities. So there isn't any really one federal law that it is encouraging people to go ahead and for the employers to create a savings program for their employees. So this is assistance from the administration, a set of rules to assist the states for employers who aren't currently offering a retirement plan to be able to automatically enroll their workers in an IRA. So they don't have a retirement plan for them, but let's automatically enroll workers in an IRA so that they start saving regardless. And the second one is for employers that do offer IRAs. They want to be able to auto-enroll the employees in their 401k plans at a rate of 5% of pay. So right now, only 78% of people who do have access to employer-based retirement savings are actually taking advantage of it. And the research shows that this could increase to 90%, or 9 out of 10 people, if they were auto-enrolled. It's so easy not to check that box or not to enroll. And the other issue is to auto-escalate the contributions. People tend, if they do sign up, they just leave it at the same rate forever, whereas if there were a slight increase, then retirement savings could actually go up by about 10% by simply making it easier, not have to think about it, auto-escalate these contributions. So the issues around retirement security are huge. They are of particular interest to women who still live longer, who still live in greater poverty in old age, and we have to have a platform and a conversation around retirement security. This is a serious issue. It is one of the big ones. On the next slide, there were a series of rules that are being modernized that came out of the executive orders. For the first time in 25 years, CMS announced that they were going to update quality and safety requirements for nursing homes. So this is huge. A lot of this is centered around person-centered care. I think some of the disappointment on this rule was that it didn't address the minimum staffing levels that many of the advocates are really looking for. Nursing homes are one of the most heavily regulated industries in the country. There's a lot of work to be done, not only on the safety and quality regulations, but as we look forward in the next 10 years, looking at other countries, particularly the Scandinavian countries, on what law, a nursing home looks like, what assisted living looks like. I think we have limited our imagination when it comes to designing these residential care facilities, and there's a lot we can do besides safety and quality to actually change the confines of the constructs of a nursing home. The second one from the Department of Agriculture, and I know this got huge applause when it was announced at the White House conference, was the ability for older persons and persons with disabilities to use their Supplemental Nutrition Assistance Program, the SNAP program, to receive food delivery in their homes. So that means home-delivered meals. Any expansion of nutrition to older adults is a good thing. There's a lot of excitement around this one. We see a lot of increasing stats about senior hunger. It's one of those issues that's been growing for years, and like senior poverty, we hear a lot more about it. It seems to be worsening, and we have to address it. I think the concern on this particular one is how much this will help expand food programs to seniors if they're low income already and they qualify for Medicaid, which many SNAP beneficiaries are. They already have access to home delivered meals. So it remains to be seen, what the impact of this is going to be. On the next one with the Department of Justice and the Victims of Crime Act, you heard Bob just talk about this. This is really to support elder victims of abuse, financial exploitation, fraud, and neglect. And there's no number. We don't know how much this is going to impact, but elder abuse victims have never had access to these funds. I am at this moment dealing with a case of financial exploitation for an older gentleman whose paid caregivers have been taking his money. So this is something that I would like him to be able to tap into that wasn't there for him before, and it can make a real difference to these people who have been victims of crime. On the next slide, caregiver assistance. So again, a big plus, elevating caregiving. You heard Bob saying that the National Family Caregiver Support Program came out of a White House Conference on Aging. Well, this time we actually had caregivers at the White House Conference. One of my fellow NCOA board members, Ai-jen Poo, did a wonderful job talking about the low pay that paid caregivers actually get, around $13,000 a year. And is that sustainable? No, it's not. So you'll see on the slide that there were a number of executive actions addressing caregiver assistance. The first one, to really set aside some priority actions around the national plan to address Alzheimer's disease. Alzheimer's disease, the rates are growing exponentially. We know we have to do something. We need to prioritize some of the issues in the national plan. HRSA is developing a training curriculum to help healthcare workforce with dementia-specific skills. I work in a healthcare program, and I can tell you that we do need this program. People that deal with seniors every day, they still aren't sure exactly what to do when they deal with somebody with dementia. They're still not reaching out to that caregiver and saying, how are you doing? I know this is tough. So this training is huge. The HHS Office of Women's Health is going to have training related to helping the family caregiver when caring for someone with dementia. And then CMS is going to help states understand that when they develop registries that connect families with paid home care workers, that it's an eligible Medicaid administrative expense. That already exists, but a lot of states aren't taking advantage of that. So we hope to increase the number of people who have access to registries where they can get caregiving assistance in their home. The next slide will be helping older Americans stay healthy. Before the conference, there was a Falls-Free Summit, and the CDC at this conference announced a free online course for healthcare professionals in falls prevention where they can get their CEUs and CMEs. The Administration on Community Living announced the update to the 2015 Falls-Free National Falls Prevention Action Plan. The National Council on the Aging actually is the National Falls Prevention Resource Center. This update on the plan, it's been 10 years. It was time. We know that falls are one of the largest medical expenses injuries and death from falls. 1 in 3 people over the age of 65 will fall every year. It's a large statistic. So that's the reason there's a lot of importance paid to falls prevention. The other point we wanted to highlight was the HRSA award, $35 million, to train programs in geriatrics. How many of us for years have been saying we need more geriatric education in the medical schools and around the country? The last one that I'll talk about was elder justice, and I'll just for a beat. So elder justice, Department of Justice is going to train prosecutors from all 50 states to prosecute elder abuse. We have the privilege of working with the Texas Adult Protective Services with Bob and the Elder Justice Coalition on one of the 5 grants from the Administration on Community Living. And so all of these training programs, we're training physicians to determine the suspicion of elder abuse. So it's a screening tool. We're screening seniors. This is going to train prosecutors. If we can train prosecutors and physicians and other people in the community to understand elder abuse, to know what to do to report it, and to really become part of the system, then that expands the reach of Adult Protective Services exponentially. All of us become their eyes and ears. All of us knowing what to do and doing the right thing can turn the tide on elder abuse, which is a huge issue. So that's very important. So looking back at the White House Conference as an attendee, the hashtag White House Conference on Aging, now what? Well, for many of us in aging, if we eat, sleep, and drink aging, there are geeks, computer geeks, and there are policy wonks. Well, for us, this was our big deal. This was our Super Bowl, our Comic-Con. It was the big thing. And we grew up learning what Bob just talked about the evolution of Medicare and Medicaid and the Older Americans Act. And maybe we'd set our expectations really, really high because of the history of the conference, because we really want to catapult ourselves forward over the next 10 years. So I think what this conference did a great job. There were new faces, there were new voices, there were public-private partnerships, and it was great to have those new voices. I personally would have loved to have seen Nora Super and Secretary Kathy Greenlee given greater visibility, and unfortunately we didn't have a lot of prominent members of the Aging Network featured on the panels. We have such tremendous expertise in aging among our peers, and it would have been nice if some of them could have given voice to ideas and issues at the White House Conference on Aging. The conference did talk about ageism. I think the President even mentioned the word ageism at some point. And this is an area that is so huge, so embedded in our culture, that it needs great thought and energy in combating it. A recent article in the New York Times talked about employees at Amazon. The 40-year-olds are afraid of being replaced by the 30-year-olds who are afraid of being replaced by the 20-year-olds. So we need to look at ageism. What is the economic cost of marginalizing 20% of our population, the elderly, as we move forward? There is a cost to that, and we really have to hit ageism dead on. It was great that the White House Conference was held in the White House. It was really a thrill to be there and to have the President actually speaking from the White House. I was sorry that we didn't have delegates, that we didn't have more time for conversation, and that we didn't have the bipartisan support we get when you have Congress and the governors nominating delegates. Because going forward, that's what we have to work with, is getting bipartisan support for all of these ideas, and that might be more difficult now. The White House Conference on Aging, with all of the pre-conferences, they addressed issues in detail, but there really wasn't enough in the conference about long-term services and supports. I think Bob said the same thing. It's a huge issue. It's a non-system. It's not only the financing, it is the entire network, the way we handle aging and long-term care and long-term services and supports in this country. So for me, it was the elephant in the room, and we have to have a coherent paid and non-paid family caregiver strategy and really build a system. The other thrill was hearing the President say the words Older Americans Act, talking about its reauthorization. It's nice to have the President acknowledge that. But what we didn't get probably was a real clear path forward. We authorized the Older Americans Act, but we have so much work to be done. We as an aging network, we the people on the phones on this webinar, have to think really clearly, what do we want to take out of this White House conference to build for the path forward? So I'm not sure how many people on the phone were aware that there were actually two conferences immediately following the White House conference. There was the first Healthy Aging Summit, and Nora Super also spoke at that conference that was planned by Health and Human Services. And for me, they were really nice bookends, and I wish everybody could have attended both or heard some of the dialogue from both, because this was the Aging Summit brought together healthcare, public health and private healthcare, researchers from academia, as well as community organizations on each panel talking about aging and moving forward with aging. It was very exciting, and I think it was part of the conversation we needed to have as part of the White House conference. The researchers were talking about the 15 most common chronic illnesses. The key indicator that someone will get that chronic disease is age. So they want to, instead of a war on cancer, a war on Alzheimer's, let's have a war on the aging process. If we can resolve and slow down the aging process, then we are going to eliminate all of these health problems. That's disruptive aging at its core. That's entirely different thinking. So bringing together this interdisciplinary approach where we have everyone working together and working on aging issues together, that is the catapult that we're looking at to move us forward over the next 10 years. I think the talk at the White House conference followed by the Health and Aging Summit were the first steps on that. But the future of aging, and Bob said the same thing, and we didn't even plan this, is collaboration. It is the definition of the Aging Network will have to expand to include all of our partners, public and private, healthcare, so that we can have a concrete foundation to address some very serious issues, but also to use our imagination and create that future we are all hoping for ourselves and for our seniors. Thank you.
Thank you, Carol. That was excellent. And Dr. Fulmer, now you've got the Bob's view of the history of the White House Conference on Aging. You've got some highlights from the one that we all just attended. So we'd love to hear your perspective on the White House Conference on Aging 2015.
Thanks so much, Brian. And on behalf of the John A. Hartford Foundation in New York City, I want to just tell everyone how excited we are to be able to support this program through our Change Agents initiative. And it's been a real pleasure for me to listen this afternoon and also to have had the privilege of joining the White House Conference on Aging, which I found very, very exciting. Certainly congratulations to Kathy Greenlee and Nora Super, who I thought did a terrific job with very creative strategies through the watch parties. I thought that probably engaged more people than it might have otherwise, and that it was a really nice way to organize groups of like-minded people around critical issues that we have to address very, very shortly in order to make sure we're ready for the next group of aging adults. And I really want to thank Bob, Carol, and Brian for such a terrific set of comments and presentations. Certainly listening to Bob take us through the history of the White House Conference on Aging with his deep, deep understanding really helps us understand the power of the conference and also sometimes where the conference has less impact. And he's really reminding us that it's crucial for us to do the next steps. And that's what all of us are on the phone today about, why we're joining this webinar. And I think Carol has really given us a nice path forward. So that personal history as well, listening to the different ways that the presidents and the Congress engaged in the White House conference, very, very important. And aren't we fortunate to have President Obama so engaged with us at this point in time, and really his participation was, I will say, electrifying. As somebody who was 20 feet away from him in a room where there's so much going on in the world, and he was so present and so engaged, and to hear a President of the United States say, we have to address elder abuse, I didn't think it would happen in my lifetime, and it was thrilling. So when I think about the conversation today and the questions that any of us might ask, I think the 4 priorities that were selected were really the right ones for now. Any of us could multiply them exponentially, but as Carol pointed out, these are the issues that are on the minds of seniors and their caregivers, and so we really have so much to move forward. And I would say that that as somebody who has been engaged in elder abuse research since 1978, that the opposite of quality of life is elder abuse. And anything that we can do to really change that paradigm and make it as important as every other form of family violence, all equally important, that we will make great strides toward healthy aging, we will make great strides toward improving long-term services and supports, and probably will make even more important strides in retirement security because people's money won't be misused. So the whole notion of being able to take a look at some of these suggestions that we've been pointed out to the website, the White House Conference on Aging.gov, really gives me great hope, and I am an optimist and will always continue to be, in that we can make important differences in retirement security. And I do believe that there will be people who will misunderstand this notion of IRAs, and that they'll say, who's taking my money? Why are they taking it? What if I don't want to do that? All of us can have a hand in helping educate the public about why we're concerned about retirement security and how some of these steps might help in getting their good ideas. The modernization of the CMS rules is just spectacular. And when we think about the opportunity for people to use supplemental nutrition assistance programs, that's very, very crucial. If you don't have adequate nutrition, you do not have health. And so right there, seeing something that's so specific and targeted to the well-being of older people. Also thinking about the ability to use VOCA dollars to support victims of abuse, financial exploitation, fraud, and neglect is a very big step forward. More recently, I was interviewing adult protective service workers and asking them about why they thought there was so much recidivism to the system, because we know that people who touch that system usually cycle through sometimes 2 or 3 times a year. And so when we think about a path out, that those VOCA funds could make all the difference in sort of creating that path. I want to give a shout out to our foundation, because currently the John A. Hartford Foundation is supporting 2 important initiatives. One is an Institute of Medicine report that should be available next spring that is on family caregiving and how all of us need to improve long-term services and support to families in order for them to truly engage in person-centered care. And also, I'm very, very pleased to be co-directing the Institute of Medicine Forum on Disability and Aging with Fernando Torres-Gil, who many of you heard at the White House Conference on Aging. He and I as co-conveners have Kathy Greenlee coming as one of our first speakers to once again look at how disability and aging communities can work together and not be splintered off in ways that take away from the sum of the parts. So that's very, very exciting to all of us. I think that what we have are some really exciting ideas about what we can do, and all of you are change agents. If you're on this phone, you're a change agent, and if you didn't know it, you are. And so what I would say is that it's all about innovation, collaboration, public-private partnerships, thinking about families, thinking about person-centeredness, and using these wonderful levers that will come from the conversations that started at the White House Conference on Aging. And I would agree with Carol's point that it would have been nice to have more visibility for the individuals like Kathy, like Nora, but all of us can continue our visibility in other forums, bring the words forward, and make a difference. So thank you for the opportunity.
Thank you so much. And let me start out with a question right back to you, Dr. Fulmer. As was mentioned at the White House Conference on Aging, it was announced that HRSA would be handing out awards of $35.7 million in training programs for what they're now calling the GWEPs, the Geriatric Workforce Enhancement Program Awards. which used to be the geriatric education centers. They're a modified version of that. Would you mind commenting on this ongoing struggle we have to prepare our health and social service providers for the aging boomers?
Sure, I will. And I was one of the associate directors for the very first set of geriatric education centers. I was at the Harvard Division on Aging, and we, along with 3 other sites, were the first GECs, and what we saw was a tremendous evolution over time in that program, really thinking about all the ways that we needed to make sure that nurses, social workers, physicians, and all of our colleagues who are healthcare providers understand what were the requisite knowledge and skills that they needed, what were the competencies that were absolutely essential for best practices for care of older adults. I think that HRSA had great courage to shift the paradigm toward this geriatric workforce enhancement program. Nobody likes change when it initially happens, but we're already seeing some very nice formations in these grants where people are focusing on the enhancement not only in the educational realm, but also at the, I'm going to call it the euphemistic bedside. So whether you're in a homeless shelter, in an ICU unit, it doesn't matter where you are. We have to make sure that that enhancement is there, and not just for professionals, but also certainly for our direct care providers, for our paraprofessionals, and for families every chance we get to educate families about, we heard the example of dementia care and how frightening that is to any of us, and for those of us who have knowledge, it's frightening. For those of us who don't, it's terrifying. So I think the GWEPs have a very nice trajectory underway. I think it'll take time for people to really work out the initiative in a way that we understand. But it was hard when we started the GEC. So I think that we cannot do enough, and there can't be enough touch points to make sure that every American has a sense of what they need to do to improve the well-being of older adults.
Thank you. Let me turn to Carol for a moment. Carol, you covered a lot of very specific substantive issues that the President and the Secretary of HHS announced at the conference. I'm wondering, do you think that with Congress and the White House as divided as they are on so many issues these days, that the smaller changes that came out of the White House Conference on Aging is really the most we could have achieved this year? You know, having a big, okay, here's the big proposal on long-term care. I just wonder how that would have fallen on Congress and the public if we would have gone those big idea ways.
Well, Brian, I think you make a very good point. Obviously, this year and at this point in this presidency, all of those heavily influence what could realistically be accomplished out of the White House Conference on Aging. So it's nice when you look at the list that it's a long list of small things that came out of the White House Conference on Aging. I think that's the positive. And you're probably right, in this environment, you know, that we can accomplish anything is great when it's so difficult these days.
Thank you. Bob, on a related note, I guess, as we came out of, I'll call it your White House Conference on Aging, although President Clinton might disagree, we had, a list of, say, 100 recommendations, and we've had those recommendations in the past. This year we don't really have that kind of a tool going forward. Would you comment on how that may or may not affect advocacy efforts in the next 10 years?
Well, I think the points that are missing from this conference, that again, with the constraints they had, there wasn't much you could do about it. Not only were there resolutions adopted at previous conferences, all 5 of the previous conferences, but they were driven by the input of delegates. The delegates came and did advocacy work on behalf of their issue and gathered votes and helped set the priorities for, what a White House conference wanted to do, since it is a unique advocacy opportunity. So what a resolution would do was provide guidance and direction to the Congress on what they should be focused on going forward. I mean, we wouldn't have had a reauthorization of the Older Americans Act in 2006 if the delegates in 2005 hadn't pushed and made that their top resolution. We've had Social Security issues be the top resolution, and then you have introduction of new issues like the grandparents raising grandchildren that were put forward. And there's something there's an imprimatur associated with being adopted White House Conference resolution on a priority basis that can set future directions. Now, in all fairness to this conference, and I think we work off of the fact sheet and the public-private partnerships that were announced, and many of them have to be followed up with for them to achieve their goals. And as you know, we're working specifically on the Victims of Crime Act initiative because that is a unique opportunity to provide well-needed dollars to help victims of elder abuse.
Let me just follow up on that, Bob, and then I'll start with you, but let Dr. Fulmer and Carol also respond. This whole notion of involving older people and making this a conference for the elderly and part of the elderly. So the input process was very different. Could you talk a little bit about the pros and cons of the old delegate process that you were involved with in '95 and then in 2005 versus this year's regional forums, and do we really feel coming out of this that older people were involved enough?
Well, Carol, would you like to lead off?
Yeah, I would be happy to lead off. In terms of were older people involved enough? I have great hope that the regional forums did include the voices of the elderly. The conference has such a long history, and anytime we go to our constituents, the people that we serve, we learn something, and we learn something important, and we have to walk a mile in their shoes. So I hope it did. I did miss the dialogue. I did miss the give and take that the delegates brought to us in prior White House Conference on Aging. We received lots of good information. There was a little Q&A, but there were a lot of older participants, even as invitees this time. We just didn't get to have the dialogue and the give and take where we get to hone those ideas like we did in the past. And Bob, I'll let you respond.
Well, my sense of it is that, first of all, we have to remember that, and I think President Clinton was the one that really refined the focus to have it be White House conferences on aging, not a White House conference on the aged. And there's a difference because that gives you a much different intergenerational focus in your policy planning, because you must be thinking about the next generation on Medicare and Social Security to do justice on the issue. But the input of older people is absolutely vital. The most well-received, with all due respect to President Clinton and First Lady Hillary Clinton and Vice President Gore and so on, the best received presentation at the 1995 White House Conference was by the 90-year-old Arthur Fleming, who held the audience spellbound with his views on social justice and social insurance and the need for a contract that between the government and the older people to be continued. I haven't seen all the documentation on this conference, but I think that you lose a lot if you're not involving older people in something where they have their stake at hand here.
And I would only add that, the famous phrase, nothing about us without us, really should be underscored here. And I think the difference, of course, is that in earlier conferences, we didn't have the capacity to do webinars and immediate responses and tweets. And so here's an entirely different strategy, and it's up to us, the people, to make sure that we don't drop the ball and let things go silent.
Right, and Terry, you're right. One of the things that we should have learned and should go forward learning is that, where there is a digital divide, whether it's geography or by age, we've got to reduce that.
Yes.
So people have the access so they can participate in the new forms of communication and be as effective.
Oh, thank you all for those answers. Let me turn to a question that was submitted, and that is really when you look at the, if you will, very focused nature of this, not particularly partisan, but it really was driven by the White House. Do you see areas where both political parties in a bipartisan way could have come to agreement that there could have been some sort of a more bipartisan approach here?
Carol,
Bob,
maybe.
do you want to start? I'll let you start, Bob.
Want me to start? Okay. Well, the answer is yes. I mean, there could have been, and there probably should have been, at an earlier juncture, more outreach and more capacity between the White House and the Congress to maintain a bipartisan nature to the White House conference. But they chose to go a different way. The reality of it is that we have seen in this Congress, and I'll point out one issue in particular, where bipartisanship has worked to the absolute benefit of older people, and that was the passage several months ago of a bill to repeal what they call the SGR under Medicare, the process under which physicians were reimbursed under Medicare, which used to cause great uncertainty to both physicians and to patients going under Medicare to visit physicians, not knowing if they were going to have their reimbursement rates cut by some dramatic number. Somehow along the way, recognizing a crisis at hand, we were able to work on a bipartisan basis to repeal that very outdated and very unfortunate provision of law. I think there were many opportunities in the issue of aging in the four priorities that were identified by the White House conference for bipartisan input, but unfortunately that just wasn't the route they took.
Yeah, and I would say, we can't give up the idea that there can be bipartisan support for aging. Everyone in Congress had parents. Many people in Congress have caregiving issues. There are so many issues around aging that resonate in a bipartisan manner. And again, it is up to us to let them hear those stories and to find those who do understand our issues and to create bipartisan support. We probably have more opportunities than a lot of other groups in terms of advancing our agenda if we can just get to that humanistic point where people in Congress identify themselves as sons, daughters, as caregivers, as family members.
I want to underscore Carol's point about the power of stories, and that is when any of us use a first-person narrative related to some of these issues, it really makes an extraordinary difference. If one thinks about Brooke Astor and her elder abuse and the way that her grandson really took on that challenge, that story was very powerful. Now, because she has such notoriety, it made the front page of the paper. Having said that, if we can use those narratives, those stories to change paradigms and have people be more aware, then we've made a big difference. I was recently in a meeting where once again I heard people talk about child abuse and family violence, and never did the word elder or geriatric come into the conversation. So words are powerful, stories help us.
And Brian, one other point that I think is worth noting that comes from the White House conference. The President's reference to reauthorizing the Older Americans Act had immediate benefits, because within several weeks, if not days after the White House conference, the Senate of the United States passed S-192, a bipartisan reauthorization of the Older Americans Act. It is imperative that the House of Representatives follow them, but the framework for that opportunity came through the White House conference.
Thank you. Let me, one other question that was submitted just now. The quote, "the business as usual," end of quote, "system isn't going to provide sufficient funds to serve the needs of the aging population. What's being done to strengthen community participation with the issues of the aging population?" Carol, do you have a thought on that?
Well, I think that we did talk about these public-private partnerships. I mean, we cannot look to the government, to the Congress, to our own aging network. We have to expand our reach. We have to look to new partners and build these coalitions. It's so important that we put all of our resources and all of our efforts together. And two heads are better than one. Not only can we raise more money, but we can get the best thinking on the issues.
Dr. Fulmer or Bob, do you want to comment on that?
I think that that's really well said, and that will make all the difference. Bob, did you want to say more?
The only thing I would say is that the need for the Aging Network and its programs and services to demonstrate its value proposition, how much through prevention you save, is attractive to both the public and private sector. But it's a story that we're not advancing enough, we're not emphasizing enough in our data collection. I think we really have to understand that there's a good investment being made in a lot of aging programs that both sides would like to participate in.
Right.
Thank you. Let me, as a reminder to everyone, let you know that those of you who have registered for today's webinar will receive a follow-up email that will give you the link to the archived recording of today's webinar, including all the PowerPoint slides. Unfortunately, we don't have any more time for questions and answers today. I want to again thank the John A. Hartford Foundation for the support of the Change Agents Initiative. I want to thank our speakers who did an excellent job today. I was there and I still learned an awful lot this afternoon. And also remind you finally that there is an evaluation that you can fill out to give us feedback so we can do a better job next time. Thank you again for joining us today.
Back.
2 o'clock, right?